Being aware of your overall health is important so that you can detect any symptoms and seek professional help when necessary. But is health merely a physical matter? While everyone is familiar with the symptoms and treatment options for common illnesses, is mental illness also given attention? Do we facilitate access to treatment and to prevention of mental discomfort and disease?
Every second week of October, the Philippines is celebrating National Mental Health Week based on Proclamation Number 452, dated August 25, 1994, signed by then President Fidel V. Ramos, while the World Mental Health Day is observed on the 10th of October every year. As stated by Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, the world is accepting the concept of universal health coverage. Mental health must be an integral part of UHC. Nobody should be denied access to mental health care because she or he is poor or lives in a remote place.
Mental health has emerged as an important public health concern in recent years, with a high proportion of children and adolescents affected by mental disorders. It is important to ensure that they are provided with proper care and treatment. In the Philippines, the National Center for Global Health and Medicine conducted a training program on the promotion of mental health focused on treatment and care in the Philippines in September and November 2019. Globally, an estimated 10 to 20% of children and adolescents are affected by mental health problems, with more than half occurring before the age of 14. In the Western Pacific region, mental disorders rank third in the leading causes of disability-adjusted life years among children, and the prevalence of suicide attempts is high. The latest global school-based student health survey found that 16.8% of students aged 13 to 17 attempted suicide one or more times during the 12 months before the survey. There are only 60 child psychiatrists in the Philippines, with a majority practicing in urban areas such as National Capital Region. In addition, there are only 11 inpatient and 11 outpatient facilities for children and adolescents, while 0.28 beds in the mental hospitals are allocated for children and adolescents. 2011 WHO Global School-based health surveys has shown that in the Philippines, 16% of students between 13 to 15 years old have ever seriously considered attempting suicide, while 13% have actually attempted suicide one or more times during the past years. The incidence of suicide in males increased from 0.23 to 3.59 per 100,000 between 1984 and 2005, while rates rose from 0.12 to 1.09 per 100,000 in females, according to Redaniel, Dalida, and Gunnell. Intentional self-harm is the ninth leading cause of death among the 20 to 24 years old. A study conducted among government employees in Metro Manila revealed that 32% out of 327 respondents have experienced a mental health problem in their lifetime.
The world faces an epidemic of mental health problems that cuts across borders, economies, and cultures, and carries a stigma that leaves people suffering in silence. First, by acknowledging mental health and wellness issues at work, we can make a difference in our homes, schools, and communities as well. Seeking mental health care should be as routine and unremarkable as seeking treatment for high blood pressure, diabetes, or a heart condition. Furthermore, we must reduce mental health inequity, a frequently ignored issue. This is often a problem in lower income communities where populations may be at greater risk of pathology and often face the highest obstacles to getting care, in part owing to a lack of specialized resources available in wealthier areas. Third, our health systems must shift from sick care to well care, to move mental well-being into the mainstream of healthcare and pursue primary prevention as the most efficient approach. We must understand how to counteract and ameliorate the effects of adverse childhood experiences, which are highly correlated with poor mental and physical health later in life. The game changer will be found not in hospitals or clinics, but in communities that nurture rather than traumatize the next generations. Last and most relevant for healthcare leaders, we must redouble our efforts to connect mind and body. By better integrating mental health services into primary care systems, we can show that a mental health condition is no different from a respiratory, endocrine, or heart issue. A healthy mind is just as important to our overall health as strong bones and hearts are.
Mental health is nothing to be ashamed about, and getting people to talk about it would be helpful to so many out there. Let's be the generation that replaces mental health stigma with mental health support. Together, we can change how the world views mental health. We can continue the mental health movement by speaking out, sharing our stories, and showing others that they are not alone. Our societal perception of mental health, including mental illness, will not change if we do not take actions to change it ourselves.
Together.
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 Together.